This is one of the dreadful side effects, and the picture here is showing actually a CT scan image of my patients who developed pneumonitis after a successful year of treatment with osimertinib and ended up in the ICU actually because of pneumonitis. So this is rare. This happens about 3.7% with osimertinib, but it can be serious. So the symptoms to report to the medical team include cough, shortness of breath. And I understand, I acknowledge that these symptoms can be hard to differentiate between, let's say, tumor progression and other EOs such as pneumonia. However, there's a really low threshold to report these symptoms to the treating doctor and medical team so that the proper investigation can be done to understand the process. When the pneumonitis is suspected, it is very, very important to hold the therapy. It's okay to hold while the investigation is ongoing, because if you continue to take EGFR-TKI therapy, and again, per the doctor's recommendation, then you put more fuel to the fire, and so that should be considered. And when the patient has hypoxia and other symptoms, then we utilize supplementary oxygen, utilize high-dose corticosteroids, sometimes empiric use of antibiotics as well is done. Next slide, please. And then cardiotoxicity, this is heart toxicity from the third generation EGFR-TKI osimertinib. And according to a recent report, the instance of decrease in the pumping function of the heart, called the ejection fraction, was reported to be about 3.9%. And so this is rare, but this is important to recognize. And I have several patients in the past many years who developed cardiotoxicity leading to discontinuation of osimertinib. And so we recommend regular cardiac monitoring for patients with the underlying cardiac risk factors. And also, it is important to report any symptoms suggestive of cardiac failure, such as a breathing problem or developing edema in the legs and other parts of the body.